Pediatric nephrotic syndrome. Patient profile. 4 years old girl, Ayesha, presented with generalized swelling. History taking. Onset and duration of symptoms. Mother reports that Ayesha developed swelling around her eyes and ankles over the past week. The swelling is more pronounced in the morning and seems to improve slightly as the day progresses. Associated symptoms. No reported fever, cough, or recent infections. Mother notes a decrease in urine output and that Ayesha's urine appears frothy. No hematuria reported. Appetite and activity level. Slight reduction in appetite, otherwise active and playful. Past medical history. No significant illnesses or hospitalization. Family history. No family history of kidney disease or autoimmune disorders. Medication history. Not on any regular medications. Allergies. No non-drug allergies. Physical examination. General appearance. Alert and cooperative child. Vital signs. Temperature 36.8 centigrade. Heart rate 90 beats per minute. Respiratory rate 20 breaths per minute. Blood pressure 95/60 mm mercury. Edema. Periorbital edema noted, more prominent in the morning. Pitting edema present in the lower extremities up to the knees. Abdominal examination, soft, non-tender, no organomegaly. Cardiovascular and respiratory examination, normal heart sounds, clear lung fields. Investigations, urinalysis, proteinuria, 3+, no hematuria. Urine protein to creatinine ratio, UPCR, elevated, indicating nephrotic range proteinuria. Blood test, serum albumin low, serum creatinine and urea within normal limits. Lipid profile, elevated cholesterol and triglycerides. Serological test, negative for hepatitis B, hepatitis C and HIV. Differential diagnosis. 1. Minimal change disease. Most common cause of nephrotic syndrome in children, typically present with edema and heavy proteinuria. 2. Focal segmental glomerular sclerosis. Less common, may present similarly but often has a more progressive course. 3. Membranoproliferative glomerulonephritis, characterized by proteinuria and hematuria, less common in this age group. 4. Congenital nephrotic syndrome, unlikely given the age of onset and lack of family history. Exclusion of differential diagnosis. Minimal change disease, most likely diagnosis given the age and clinical presentation. Definitive diagnosis often made based on response to corticosteroid therapy. Renal biopsy not typically performed initially unless there is steroid resistance or atypical features. Focal segmental glomerular sclerosis and membranoproliferative glomerulonephritis. Considered if there is no response to steroid or if there are atypical features such as persistent hematuria, hypertension or impaired renal function. Management plan. Hospital admission. Recommended for initial management and monitoring. Corticosteroid therapy. Initiate prednisolone at a dose of 2 mg per kg per day, maximum 60 mg for 4 weeks, followed by a tapering regime as per RCH guideline. Diuretics. Consider for significant edema causing discomfort or respiratory compromise. Monitor electrolytes closely. Dietary management. Advise a low sodium diet to help manage edema. Infection prevention. Ensure up-to-date vaccination. Consider prophylactic antibiotics if at high risk of infection. Monitoring. Daily weight, urine output and regular monitoring of blood pressure, serum electrolytes, renal function and urine protein levels. Family education. Educate parents on the importance of medication adherence, monitoring for signs of relapse, example recurrence of edema, and when to seek medical attention. Reassurance and additional points. Prognosis. Inform parents that most children with nephrotic syndrome respond well to steroid therapy, with many achieving complete remission. Relapse awareness. Educate that relapse can occur, especially following infections, but can be managed effectively with prompt treatment. Long-term outlook. Emphasize the importance of regular follow-up to monitor growth, development, and kidney function. Support resources. Provide information on support groups or resources for families dealing with pediatric nephrotic syndrome.